checked the door for precautions. There's no precautions, so I'm just going to proceed with standard precautions. Hi, my name is Sayelda. I'm your student nurse today. How are you feeling?
I feel okay.
Okay, I'm just going to check the room for your safety. I see that there's no spills on the floor. There are no hanging cords. The bed is in the lowest position. I checked the wall. There is oxygen attached. There is normal air attached. And I see no IVs. I see no IV site. Okay, I'm going to just check your identification. What's your name?
Delivers.
What's your last name? And what's your birthday?
January 1259.
Do you have any allergies?
No.
Okay. I'm going to do a physical assessment on you. I'm just going to wash my hands really fast. Just give me 1 second. I'll be right back.
Okay.
Okay. I don fresh gloves. I'm going to start with hair assessment. Is it okay if I touch your head?
That's okay.
Okay. Do you have any trauma to your head? No headaches?
Nothing.
Okay. Okay, I'm palpating and I'm checking the scalp. I note no pediculosis. The hair is normally distributed. I see she has good hygiene. I feel no lumps, bumps, bruises, or tenderness. Do you feel tenderness when I touch you? No pain when I touch you?
No pain, no nothing.
Okay. So her head is normal cephalic, she has normal hair distribution, and she has no trauma or any abnormalities to the head, so I'm saying that she is normal cephalic. I'm going to take off my gloves and put on fresh gloves. Okay, I'm going to touch your face now. Is that okay?
No problem.
Okay, do you have any pain to your face?
Nothing.
Okay. I'm going to start palpating the sinuses. Okay. Tell me if you feel any pain, okay?
No.
Sorry. Okay. I note normal hair distribution on the face. I don't see any edema. Okay, her sinuses are fine. Okay. I see no scarring or bruises. I'm going to check your nose, okay?
Okay.
Do you have any problem smelling?
Okay.
I see no deviation. I see no polyps. I see that there's normal hair distribution. I see no swelling to the sinuses. Okay. Next I'm going to be checking your eyes. Do you wear glasses?
Yeah, I have glasses.
Okay. Do you use them to see up close or for farther?
I'm close. I see far. When you put glasses, I see close.
Okay. So cranial nerve 2 optic is impaired. The patient does wear corrective lenses and she is farsighted. Okay, I'm just going to be checking the size of your pupils. They are about a 5 on both sides. I see that your lashes are normally distributed. I see that your sclera is white. I see that your conjunctiva is pink and moist. Okay, I'm going to be checking the reactivity of your eyes. Okay, it's going to be a bright light. Okay. The eyes are consensual, they're reactive, the reaction is brisk. Okay, I'm going to be checking the 6 cardinal fields of gaze and accommodation. Can you read my name on my badge?
Sayelda.
Okay, what does that say?
Compass.
Okay, the eyes accommodate. Follow the tip of my pen without moving your head, okay?
Okay.
I'm checking for ocular motor, ocular motor. The left eye is abducent, the right eye is ocular motor. The left eye is trochlear, the right eye is ocular motor. Keep following. Okay, ocular motor, ocular motor. The right eye is abducent, the left eye is ocular motor. The right eye is trochlear, the left eye is ocular motor. Okay, the 6 cardinal fields of gaze are intact. Cranial nerve, cranial nerve 3, ocular motor, cranial nerve 6, abducent, and cranial nerve 4, trochlear are intact. I'm going to be checking for convergence. Follow the tip of my pen. Okay, your eyes converge normally. Okay, I'm going to continue along the facial assessment. Can you close your eyes for me? Can you say yes when I touch your face?
Yes.
trigeminal is intact. Can you do what I do? Mute sucio. Okay, facosa. Okay, stick your tongue out. 7 facial is intact. Next, I'm going to be moving on to your ears. Do you wear hearing aids? Hearing aids to help you hear better?
Yes.
No, you don't. Do you wear hearing aids? Like, no, right?
No.
Do you have any pain to your ears?
No.
Do you hear ringing like on bell up sonne? Nothing?
No.
Okay. The pupils were equal, round, reactive to light. They accommodate, they converge, and they are consensual. Her ears are intact. I see that they're symmetrical. There's no extra drainage, no bleeding, no extra cerumen. You feel no pain, right?
No.
Okay. I'm gonna do a test. When I say something in your ear, say it out loud for me, okay?
Bible. Apple.
Okay, cranial nerve 8, acoustic is intact. Next, I'm going to be moving on to your mouth. Do you have any cavities?
No.
Do you have any pain in your mouth when you're chewing?
No.
Okay, smile for me. Okay. I'm checking the hard and soft palates. Can you open your mouth for me? Say ah. Say ah.
Ah.
Okay, the uvula rises midline. I see that the hard and soft palate are intact. Can you lift your tongue for me? Okay, the frenulum is intact and it's midline. Okay, I see no trauma. I see no lumps. I see no bumps or bruises. Okay. Can you bite for me? Okay, the temporal mandibular joint is intact and I feel no clicking. The patient has no pain upon chewing. Okay, so I'm gonna check your throat now. Can you swallow for me? Swallow. Look what blown by. Okay, can you say ah?
Ah.
Okay, the trachea is midline. I feel no lumps, bumps, bruises. Okay. Cranial nerve 9, glossopharyngeal is intact. Cranial nerve 9, vagus is intact, and cranial nerve 12, hypoglossal is intact. Next, I'm gonna have you lie down for me. Push up again. Sorry. I'm checking your neck. Let me see. Okay, I see no pulsations. I see no bruises. I see no abnormalities. I'm gonna be checking your carotid artery. Are equal, +2, normal. She is negative for distension, negative for jugular vein distension. I palpated, no abnormalities. Now I'm going to be listening for bruits at the carotid artery. Hold your breath. Okay, turn your head that way. I'm palpating with the bell for bruits. The patient is negative for bruits. The trachea is midline. Okay. Okay, so I'm gonna be checking your strength. So let me push it. Okay? Push for me? No, push. Push. Okay. Mama, if you just go. Okay. this side. Okay, she is strong, symmetrically and bilaterally. Cranial nerve 11, spinal accessory is intact. Next, I'm gonna be checking your thorax. Do you have any pain in your chest?
No.
Do you check your breast for lumps? Like, ça j'ai like, boule na tête nous? Ou toujours checker si vous avez une boule? Ou bien une boule, toujours?
No.
Okay, so I'm gonna check your chest. Is that okay?
Yes.
It's okay? Okay.
Yes.
Okay, I'm palpating. I see no lumps, bumps, bruises. She checks her breast monthly. That's what I asked her in Creole. And she said that she has no lumps or bumps. And yeah. Okay. So her thorax is in check. You have no pacemaker?
No pacemaker.
Okay. Next, I'm going to be listening to lung sounds. I'm going to be starting on the right side above the clavicle. I'm listening for vesicular sounds. Take a breath for me. Take a deep breath. Yeah. Okay. The vesicular sound on the right side is normal. It was louder on inspiration. Next, I'm going to be checking for bronchial sounds. Take a breath for me. Let it out. Okay. Those are louder on expiration. That is normal. I'm checking above the left clavicle. Let it out. Okay, it was louder on inspiration. It's normal. I'm going down the left border down to the second intercostal space. Hold on. Okay, those are bronchial vesicular sounds, and they are normal. I'm going down to the third space. Go again. Let it out. I'm going down to the fourth space. This is now vesicular sounds. They're louder on, let it out. On inspiration. Oh, wait. No, I did that wrong. Sorry, let me do that over. Okay. So I started on the right side at the take a breath for me. Let it out. If I was in Kimberly, just take a deep breath and let it out. Okay. All right. Let it out. Do like this. Just like that.
Okay.
Okay. So I'm checking over the, yeah. Okay, the vesicular sounds. Now I'm checking the bronchial sounds over the trachea. They're louder on expiration. Next, I'm checking the left clavicle. They're louder. They're vesicular sounds that are louder on inspiration. I go down 2 spaces. These are broncho-vesicular. Then I go across the chest to the second intercostal space. Broncho-vesicular. I go down to the third space. Okay, I go across to the left border, third intercostal space. Then I go down to the fourth. These are vesicular sounds now. Then I go across. Okay. Okay, mamando pour lever tete pour me catcher qu'un batete. Okay. Oh, no, it's fine, it's fine. Yeah, just do that. Okay. I'm checking the fifth. Intercostal space. Okay, that's fine. The anterior lung sounds are clear. I hear no abnormalities. I hear no rails, no crackles, nothing. Next, I'm going to be checking the back lungs. Okay. Okay. I'm going to be checking your back lungs. I'm going to be checking the is between the scapula and the spine between C7 and T10. I'll mostly be hearing the lower lobe. So whenever I touch you, take a breath. Just like that, okay? So I'm checking, put your head forward like this. Okay. So I located the most prominent bone, which is C7. I'm checking in between the intercostal space. Take a breath. Okay, I go across to the other side. Okay, I go down 1 intercostal space. Okay, keep going. Keep going. Keep going. Keep going. I'm just going across and going in a zigzag pattern until I reach T10. Okay. 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 Lift your arm for me. Okay. So I'm going to be checking. Take a breath for me. Okay. These are vesicular sounds on the sides. Okay. And they're louder on inspiration. Take a breath. Okay. Okay. I do note that a normal exam would take place under the clothes, but she is wearing a dress. That's the only reason why I didn't check with the stethoscope to skin. But other than that, her lung sounds are clear. I hear no abnormalities. She's able to inspire and expire symmetrically and bilaterally. I'm gonna check your back. Can you stand up for me? Hold on. Turn around. Hold on. Okay, I'm checking for excursion, so I'm gonna put my hands on both sides. Take a breath for me. Okay. One more time. Okay. Hold on 1 second. The lungs are equal upon inspiration and expiration. I see no abnormalities. She's not favoring any side. Okay. I'm gonna be checking for barrel chest, so I'm measuring that from front to back. It is less than half. Front to back. It is less than half of the transverse, and it is, so she is negative for barrel chest. Okay, I'm gonna push it actually. Wait, I like Shiba. Sorry. Okay, next I'm going to be listening to heart sounds. Okay. I'm going to be starting at the right border, second intercostal space. So right border, midline, 1, 2. I'm listening for the aortic sound. It is louder on the S2. Then I go over to the left border, second intercostal space. This is the pulmonic sound. It is louder on the S2. I go down 1 intercostal space to the 3rd intercostal space, listening to the Erb's point. S1, S2 are equal. I go down to the 4th intercostal space. This is the tricuspid. S1 is louder. Okay, levitete encore. I'm listening to the mitral point for 1 minute because this is the maximum point of impact and the S1 is louder. Okay, we're pretending that 1 minute passed and the heart rate is 65 beats per minute. Now I'm going to be inspecting the abdomen. How is your diet? How often do you eat?
Every day?
Yeah, how often do you eat? Like 3 times a day, 2 times a day?
3 times.
Okay. Do you have any problems with your appetite, like gain foie ou pas manger or nothing like that?
Yeah.
Ou si tellement besoin de vomir?
No.
Combien de fois par semaine ou use baduna pour?
Every morning.
Okay, so I asked her if she had any nausea. She said no. Pas gain pain?
No.
She has no pain. She does a bowel movement every morning at the minimum. She eats 3 times a day. Her diet is regular, and sometimes she doesn't have an appetite, but she still tries to eat 3 times a day. Okay, so for the abdomen, first we look, then we listen, and we feel. So I'm checking the abdomen. I see no Again, she's wearing a dress. In a normal case, I would undress her, but this is my mother. So I'm checking. I see no lumps, bumps, bruises, no lacerations, no pulsations. I see no abnormalities. Next, I'm going to listen, starting at the right lower quadrant. I listen for a minute. I hear between 5 and 35 abdominal sounds, so it is normal and active. I move up to the right upper. I hear between 5 and 35 sounds, so it's active and normal. For 1 minute, I listen. I move to the left upper. Hold on. Okay. Sorry. I move to the left upper. I hear between 5 and 35 bowel sounds, so it is normal and active. I move to the left lower, between 5 and 35 abdominal sounds within a minute, so it is normal and active. Now I'm going to palpate là où pisser ou point en sang qui fall. Il pas fait mal là où pisser. Okay, I just asked her about her urinary habits. I'm palpating along the ascending, transverse, and descending bowels. I feel no lumps, bumps, bruises. I feel no abnormalities. I'm going to auscultate. Oh, I asked her about her urinary habits, and she says that her pee smells normal. It has no abnormal color, and it doesn't hurt to urinate, so her urinary patterns are normal. I'm going to be listening to the abdominal aorta. It is between the umbilicus and the xiphoid process, slightly to the left. I'm going to listen with the diaphragm, and I hear xiphoid process, abdominal, slightly to the left. Okay, I hear no bruits. I hear no abnormal sounds. Okay, umechita. Okay, so the abdomen is intact. I detect no abnormalities. Next, I'm going to be checking the upper extremity. Can you put out your hands for me? Just put them straight. Okay. So I'm gonna be checking for circulation. I see that your capillaries refill less than 3 seconds, and they're brisk. Close your eyes for me. Dim ki me mpeze.
Left and right.
Okay. Di oui la moyen. Close your eyes.
Okay. Oui.
Okay, let me see your hands. Squeeze my hands. Okay. Do pronation. Do supination. Okay. Mettez main comme ça. Pese même. No, like poussez même. Okay. Vire même. Poussez même. Okay. Circulation, movement, sensation, range of motion are all intact. Next, I'm going to be checking the lower extremities for circulation. I check the toes, that the capillaries refill less than 3 seconds. Femegio, tell me which foot I'm touching.
Left.
Which foot am I touching?
Right.
Okay, that is circulation, that is sensation. I'm gonna check movement. Okay, Pizzanen. Okay, she is strong, equally and bilaterally, both in the upper extremities and the lower extremities. Can you flex for me? Flex your feet like this. Flex your feet like this. Okay, do like this. Okay, go like this. Do like this. Okay, good. So she has great range of motion. Next, I'm going to be checking your back. Okay. Turn around for me. When I was checking the abdomen, I would have done a vaginal exam, and after this back exam, I would do a anal exam. So what I'm checking for is for alignment of the spine. Do you have any back pain?
No.
Okay, I'm just palpating. I feel no abnormalities. I see no abnormalities. Tell me if it hurts when I touch you. Nothing?
Nothing.
Okay, umachita. Okay, so that is the conclusion of our physical exam. Can I get you anything?
Excuse me?
Can I get you anything? Do you want any water, anything before I leave?
Nothing.
Okay, I made sure your bed is in the lowest position. I made sure that you are safe. Okay, I asked if you needed anything. You said no. I'm gonna close the lights and call me if you need me. This is your call bell and this is your belongings, your cell phone. Anything you need, just call me. All right, I'm gonna close the door. I'm gonna wash my hands, and that is the conclusion of my physical assessment. Thank you so much. You were a great patient. Good, thank you.